Hey, it's Dr. Murphy. So today we're going to talk about congestive heart failure or heart failure. So that's a topic that's trending right now in the media. So I thought it would be good to let you all know a little bit about it in case you were curious. So congestive heart failure is when your heart is either weak or stiff, so it's not pumping blood or it's not receiving blood like it should. So, like we were talking about with hypertension, the ventricle on the left side of your heart pumps the blood out to your body. And whenever it can't pump as well because of its being weak, that's when we diagnose you with heart failure. And the numbers vary. It's not like a linear process where you want 100%. You really want to get between 55 to 70% of heart function. And when you drop below 50%, that's when we get concerned and explore a more workup to see if you do have heart failure and why, because that will guide your treatment. So there's two different forms of heart failure. Systolic is the one where your heart is weak, like we just talked about, and it can't pump blood as well. Diastolic heart failure is when your heart is stiff and it can't fill up or receive blood as well as it needs to. So systolic is the more severe form, diastolic is the milder form. And they are treated differently, so it's important to distinguish. So, symptoms you may have when you have heart failure may include shortness of breath, and that can be while just sitting or when you're up moving around, exerting yourself. So, you can have shortness of breath at rest or with movement. You may see that you're not able to lay flat like you used to, and you're using more pillows, or you're waking up at night suddenly short of breath out of the blue. You may be more tired or weak during the day. You may have swelling in your legs, your arms, not your arms, your feet or your belly. Um, and you would, if you start seeing multiple of those signs at the same time, that's a clue. Sometimes it can be sudden, sometimes it can be gradual, but you definitely want to make your doctor aware so that they can start doing some testing to see if you do have congestive heart failure. So they will do blood tests, they'll do imaging, such like a chest x-ray where they can see if there's fluid in the lungs. They'll do an EKG to look at your heart activity. They'll do an echocardiogram to look at the actual heart structure and function to see if you do have heart failure. So before we talk more about this topic, I want to make sure that you all go and like and subscribe to the channel so that we can continue to grow and provide you with good content. So once they do the testing and formally diagnose you with congestive heart failure, again, your treatment plan will depend on if you have the systolic form or the diastolic form. So the diastolic form, it'll be, of course, lifestyle changes with reducing your sodium, with making sure that you are keeping a good check on your weight, your blood pressure, your heart rate every day, and exercising and just doing more of the things at home on a day-to-day to keep your symptoms under control. You may be prescribed a medicine if you're having a lot of fluid buildup to keep the fluid level down, but you may not have other medicines that you have to take every single day. It really depends on what your cause is. So, for example, if it's due to blood pressure, of course, you may be on treatment for that. Or if it's diabetes, you may be on treatment for that. But you may not have a special medicine specific to the diastolic heart failure to take every day. It may just be as needed. And that's usually a diuretic. But if you have the more severe form systolic heart failure, typically you will be on multiple medications, two or more, because the studies have really shown that with the medicines they prescribe, that you live longer, which is very important, and that you have less symptoms, and you usually require less hospitalizations. And so That's why it's really important for them to prescribe the multiple medicines that they've seen to benefit you in those ways, and that you adhere to taking those medicines. And if there's some kind of barrier preventing you from doing so, it's important to make sure you let your primary care doctor or your cardiologist, which is a heart doctor, know what those barriers are so they can kind of help figure out an alternative to that. So, heart failure also can occur after pregnancy. I do want to mention that. Some women, after they deliver, will start to have signs such as swelling, shortness of breath, and fatigue, where they need to let their obstetrician or their primary care doctor know if those occur, because we do have what we call postpartum cardiomyopathy, which is a big risk factor for heart failure. So that's something just to keep in mind if you are of childbearing age and pregnant. So aside from that, managing heart failure at home, again, you want to weigh yourself every morning after you've emptied your bladder. Make sure that you're not suddenly gaining 2 pounds in a day or more than 4 pounds in a week. If so, that would be a sign that you're building up the fluid and that you may need your medicines adjusted. So you want to notify your doctor or your cardiologist, primary care, nursing, whoever you have as your support person to call in those situations. And aside from keeping up with your weight, you want to, like I said before, keep up with your sodium intake. That may vary the amount they tell you, depending on if you just have high blood pressure or heart failure with high blood pressure. But typically, it is less than the 2,000 milligrams of sodium per day. And your fluid also may be restricted if you have systolic heart failure, to where you can't drink more than 1.5 liters or 2 liters a day. Again, that would be individualized based on your unique situation, depending on what your ejection fraction is. And also, some people with a very low ejection fraction, like less than 35% or less than 30%, they may speak with you about a defibrillator because you're at a high risk of heart arrhythmia where your heart is not beating well or normally, and you could have sudden death and your heart just stop. And so that defibrillator would protect you from that. So that's just some general information about heart failure so that you're more aware of what it is and what signs to look out for in case you do develop symptoms. And I do have some other videos on risk factors like hypertension or high blood pressure that you can check out as well. So if you have any questions about heart failure or high blood pressure or any medical concerns at all, just go ahead and leave a comment so I can look at those and give you some feedback. Thank you all. Bye bye.